Spotting PTSD and Addiction, an insightful guide for awareness. Post-traumatic stress disorder, PTSD, and addiction are two conditions that can have devastating effects on individuals, their families, and communities. This guide will teach readers how to recognize the signs of these disorders, understand their underlying causes, and take positive steps toward intervention and support. By creating a space for education and empathy, you can work towards a future where those affected by PTSD and addiction receive the care and compassion they need. PTSD, an overview. PTSD is a psychological condition triggered by exposure to a traumatic event. Common symptoms of PTSD include nightmares, flashbacks, anxiety, difficulty sleeping, and avoidance of situations that may remind the individual of the trauma. Potential causes for developing PTSD include experiencing a life-threatening event like war or assault, childhood trauma, or witnessing painful events. Addiction, an in-depth look. Addiction is a complex issue that affects many individuals and can take many forms. Common types of addiction include drug, alcohol, gambling, food, sex, and internet. Each addiction type has its characteristics and symptoms, varying significantly from one person to the next. It is essential to understand the various aspects of each type to address this issue effectively. The connection between PTSD and substance abuse. Research has increasingly indicated a strong correlation between addiction and PTSD, indicating the need to further explore the relationship between these two conditions. Various studies have revealed that individuals with PTSD are more likely to engage in substance use than those without the disorder. Additionally, numerous reports suggest that both alcohol use and drug misuse can be used as coping mechanisms for people with PTSD. Moreover, those affected by this dual diagnosis of PTSD and drug addiction often experience other mental health problems, such as depression or anxiety. The prevalence of PTSD in addiction. Studies have suggested that individuals with a history of PTSD may be more likely to develop an addiction than those without the disorder. It also indicates that among people who suffer from both substance abuse and PTSD, there is a strong correlation between them. People with PTSD are twice as likely to engage in substance abuse, and those with substance abuse are 3 times more likely to have PTSD. Studies have also shown that up to 50% of people struggling with addiction also meet the criteria for PTSD diagnosis. How substance abuse exacerbates PTSD symptoms. It has been observed that the use of substances can worsen symptoms associated with PTSD, leading to further psychological distress and impairments. Substance abuse may serve as a coping mechanism for individuals with PTSD, but it merely masks the underlying issue rather than addressing it. Research suggests that substance misuse increases the intensity of intrusive thoughts and memories related to traumatic events, thereby amplifying negative emotions such as fear and guilt. Moreover, repeated episodes of intoxication can lead to difficulty sustaining interpersonal relationships or employment opportunities. Identification and support strategies. Identifying the presence of comorbid PTSD and substance abuse can be challenging due to their overlapping symptoms. However, specific strategies may be implemented to identify signs of PTSD and addiction in an individual. A health professional can assess for clinical signs, including mood, behavior, physical health, and cognitive functioning changes. Therapeutic approaches and recovery. Therapeutic approaches to treating concurrent PTSD and drug addiction involve creating a comprehensive treatment plan that addresses the individual's needs. This should include psychotherapy and medication management, which can assist in reducing the symptoms of both disorders. For those with addiction issues, motivational interviewing and 12-step programs may help individuals stay motivated in recovery. Both mental health and substance use issues must be addressed for successful outcomes, as it is common for one disorder to mask the other. Understanding the link between PTSD and addiction is the first step towards healing. If you or a loved one is facing these challenges, support is available through our addiction recovery in Tennessee. With expert care and a compassionate approach, the road to recovery can be within reach. Don't wait, reach out to Haven House Recovery Center today and take the first step toward a renewed life.